America today is on fire as case of malaria was discovered in different cities. When the U.S. Centers for Disease Control and Prevention, CDC, found 4 malaria cases in Florida and 1 malaria case in Texas, it created quite a buzz. After all, these were the first reported cases of people actually catching malaria in the US since 2003. Finding these 5 cases has raised questions about whether malaria may return to the US and whether climate change may be opening the gates for Anopheles mosquitoes to spread. This news has brought about conspiracy theories, pointing fingers at the billionaire philanthropist Bill Gates. This included claims that Gates was somehow responsible for these new malaria cases via his project that has released genetically modified mosquitoes in the US. However, such claims really provided zero supporting evidence. Liz Churchill, who even calls herself a conspiracy theorist, said, "It must be a coincidence that from 2003 to 2023 there wasn't one case of malaria spread by mosquitoes, and along comes a company funded by Bill Gates to solve a problem that didn't exist. Suddenly in the exact places where he releases mosquitoes there's an outbreak of malaria." There hasn't been a case of malaria caught locally in the US in 20 years. Malaria is a disease spread when the female Anopheles mosquito feeds on a person with malaria, and then feeds on another. The mosquito can be found in certain regions in the US, but malaria is still rare in the US. Worldwide there are 240 million cases each year, 95% in Africa. That could change with the climate crisis. Scientists have been warning people that malaria could become more common in the US, as temperatures warm. Warmer temperatures, and presence of stagnant waters creates more habitat for mosquitoes and increase the mosquito bite rate. The cases in the 2 states, Florida and Texas, don't seem to be related to each other, the CDC said. The 4 cases in Florida are all in the same area, so there is active surveillance in the region to see if anyone else gets sick. Public health authorities are also monitoring and trying to control the local mosquito population. The CDC says that all the patients with malaria are in treatment, and all of them are improving. The last time the US saw locally acquired cases was when 8 people got sick in 2003 in Palm Beach County, Florida. Even with these new cases, the CDC says the risk of catching malaria in the US remains extremely low. With the busy summer travel season, the CDC said, more people could bring the disease back to the US. The CDC encourages people to use bug spray while traveling. Malaria is a medical emergency and should be treated accordingly, the CDC said. Prompt treatment can prevent malaria symptoms from getting worse or even causing death. Thanks for watching, subscribe, and share this video to your loved ones to ensure they are safe.